Hello everyone, welcome to Talking Health with Dr. Laz, your favorite health program on television. Reaching you from Nigeria's capital city, Abuja, my name is Dr. Laz Eze. On this day last year, 2020, COVID-19 lockdown was still on all over the country. Single topic in the media was mainly about health because of COVID-19 and different aspects of the conversation. I recall then I was a regular guest on AIT and many other TV stations, radio stations, just talking about COVID-19, our healthcare systems, and how we could make our hospital to work. So one of the positives that came out was the Make Our Hospital Work campaign, which was an initiative I started and shared with a lot of Nigerians and also on social media, and so many persons signed up. At the moment, there are presence of campaigners in the 36 states of the country and the FCT. And Talk Health Nigeria, has been using the platform, to support the campaigners to push this campaign. It's essentially a citizen-based community, a citizen-led community-based campaign where individuals sign up, have access to resources that is being shared, and also volunteers who are healthcare workers, people from diverse backgrounds, just to make sure that they play their part to make the healthcare facilities in their communities to work. So today, 15th June 2021, is exactly 1 year that the Make Our Hospital Work campaign was launched. And I'm going to be speaking with the board chairman, the chairman of the Strategic Advisory Board of the Make Our Hospital Work campaign, and also the team lead of the most active community so far, on this campaign. We're going to be talking more around how you and everyone that is watching can play a role to make sure that our healthcare sector works better than it is right now. So we'll take a break. I'm going to be showing my guests after the break. And when we return, you get to meet them and we talk more about these issues. But don't forget to follow us on our various social media and those Twitter, Facebook, Instagram, and also subscribe to our YouTube channel so that you can watch our previous episodes as many times as you deem fit. Do stay with us, we'll be right back. Welcome back to Talking Health with Dr. Laz, your favorite health program on television. Yes, my guests are already seated with me in the studio. Let me begin from Dr. Lola Mabogunje. We call her Mama within the public health space. She's played motherly role on a lot of issues. She is the chairperson of the Strategic Advisory Board of the Make Our Hospital Work campaign, a medical doctor, public health specialist, and also Mama Malaria, if I must add that aspect. You're welcome to the program, ma.
Thank you very much for bringing me here. I appreciate.
You're welcome, ma. Also joining us is Mr. Caleb Onoja Akogwu. Caleb Onoja is the team lead for the Ogugu Make Our Hospital Work. Ogugu is a community in Olamaboro, local government in Kogi State. And his team has been adjudged as the most active, in terms of their efforts to make the Ogugu Cottage Hospital to work in their community. You're welcome to the program.
Thank you, Doc. It's a pleasure.
Yes, thank you. Good to be here with both of you. It started like an idea, and right now is something that many persons have signed up to on the roles of the community in making the health sector to work. The first ever topic we treated on this program was healthcare systems, strengthening the health system. And that was precisely on 18th August 2020, when we started this program, breaking down the different aspects of the healthcare system. And one of the key points that was made was the roles of the community in making the healthcare system to work. So let me begin with you, Dr. Mabogunje. First will be why are you involved in the Make Our Hospital Work campaign? Why do you choose to provide support to this team of Nigerians who are making efforts?
Many thanks, Dr. Laz. Over a year ago, when you met me, you were worried about the status of the COVID-19 issue in this country. And we both sat and discussed a lot what was happening. And we realized that we have a challenge with the health system. You told me you wanted to set up making our hospital work. We changed the topic, we back, and we zeroed in on the primary healthcare system, because that is the root of any facility. So what really got me to commit my time with you into this issue is that health is the priority for all. We have demonstrated, COVID-19 has demonstrated that health has brought everything to a standstill globally. People think it's economy of law, but health brought economy to a standstill, brought social services to a standstill. So without health, we cannot move anywhere. The adage is health is work. So if you look at that adage, health is work, making us have a good access to health, it's a primary concern for me. Not just being a doctor, but if you have health, you have wealth, you have life. So if you don't have health, then what do you have? You don't have anything. So that got me say that I can't contribute my role to ensure that the hospital, particularly the primary healthcare system, work in Nigeria as much as I can. So it's a motivation I have to make sure that health is a priority and everybody within this country should have access to health.
And not just access to health, but quality, preventive.
Let me define this: quality healthcare service.
Great. So, yes to you, Caleb. How did you get to know about the Make Our Hospital Work, and why are you interested? First of all, what's your professional background?
All right. Thank you very much, Doc, for this opportunity. I am a botanist by profession. I got my degree from the Federal University of Agriculture, Makurdi, Benue State.
Botanists is those who study about plants?
Yes. Okay. But I have interest in the medicinal aspect of botany, which is pharmacognosy. And I'm currently awaiting NYC. I have interest in health. I need to say that. And I got to know about Make a Hospital Work from a friend, Zach Elvins. He told me that a group of Nigerians that sponsor the Not Too Young to Run bill are putting something together, and he would like me to be part of it. And I said, yes, that's good, I'm okay. So we started a campaign on the 15th of June, and Ogugu Make Our Hospital Work campaign actually came on the 16th of June, immediately after the conference. And we had already done a sensitization about COVID-19 in my community. So the youth were ready. They only needed a platform to flourish. So when the campaign came about, we contacted each other and we started work immediately. And we took the campaign to our royal fathers, health stakeholders, the clergy, and the youth, and they embraced the campaign, and we started work immediately.
Okay, so we'll get to know more about what you've been able to do.
All right.
But let me get back to Dr. Mabogunje. What's the role of the community in primary health care? We know that over 80% of the healthcare conditions can be prevented or managed at the primary healthcare level. But that's not the case because most of them are not fully functional. And there is a huge gap in community participation. So how can this be improved? What are those roles the community needs to play, and what do we need to do better to make the communities to begin to play those roles?
Many thanks, Dr. Laz, for the question on the community. And the community has a huge role to play on their own healthcare. I use their healthcare. You notice I've changed the word because it belongs to them. The primary healthcare belongs to them. They are to engage the policymaker, which is at that level. They are to ensure that there is supply in their own facility. When I mean supply, is that drugs should be available in the hospital for them. The staff, all the resources, let me use the word resources. Resources means the human, drug, commodity, and any other thing the hospital needs. It's when something belongs to you, there's a way you manage it. So the first thing that the community see a primary health care as their own, it belongs to me. So how do I want it to function well? They are also to make sure they create demand. I don't have to come from the town to create demand.
What do you mean by creating demand?
People go to the facility. If there's a
Okay.
hospital, I don't go. Then what is the point of me staying there? So it's onus on the community to make sure that people are aware, creating demand. If there are issues that they are not clear of within the hospital, the community must be engaged to do that. Luckily for us, Dr. Laz, there's this World Health System, which is the smallest unit of health in this country. The World Health System has a World Development Committee, which part of the World Development Committee is the World Health Committee, and it's made up of community people. What are their roles? They are to make sure the facilities within those wards are functioning properly. And when it's functioning, it provides quality health, staffs are there are resources there. So the role of the community is to ensure that they have quality health. Another role for the community is accountability. You know, Dr. Laz, that's my favorite word. Accountability is that the people working in the facility are accountable.
It's not just about money, because that's what many people get to think about when you mention accountability.
I'm accountable in terms of my time, instead of make sure that facility is okay. If there are things installed there, the community must ensure that those things installed are in place.
And the community should know when it's being installed, right?
They should know when
many times things are procured, taken to health facilities, and the people don't even know that those things are there.
Dr. Laz, you've taken me back. They should even be involved in the siting of the facility. You just don't go and site facility for me in my community. We should sit together, we discuss, okay, we want the facility to be sited where, and we give reasons for it. We'll engage ourselves, make sure the facility is clean, make sure the staffs come. If the staff have a challenge, make sure we support them to do so. I've worked in Kano once where a facility realized that they did not have a service provider, somebody that take care of them, and they engage the service provider, provided a machine to be ferrying the person to and fro. So the community owns
So the community hired a health worker.
The government was paying, but
Okay.
they made sure that the transport, which was the issue, was addressed by them.
Okay.
So I'm saying that the community owns the primary health care facility. It
Right.
belongs to them, and there is accountability for the service provider to them, and they too are accountable to using the facility. And accountability doesn't stop at accountability. It means that if there are things not done, it must be enforced. There should be a carrot and stick method. If somebody is doing well, they encourage the person.
them, right?
Not with money, please.
But if they have money, of course, nothing stops
You
them.
see, it's even going to say well done. Do you know it's a big word for me? Thank you very much.
Right. So it's not only when they have money, but they can
have
even recognize the person in the community.
Community day where they say, oh, this person has done well. And then they recognize
clap for the person.
It belongs to the community.
Okay, so we are approaching the period for our break, but just before we take the break, let me ask you, what have you been able to do so far, within your community in Ogugu?
Right. Thank you very much, Doc. As a campaign, we started by taking this campaign to people. We did that to make sure that this campaign really sinks in the mind of the people, because Kogi State, Ogugu, they are very political. So we don't want the campaign to be a form of political campaign or a propaganda. So at first, we took the campaign to the Chief Medical Director, Kogi State Hospital Management Board, Dr. Osman Zekeri. We introduced ourselves to him that this is what we are about to do. And he said, yes, we can go on, that we should be careful that we don't divert the attention to politics. So we started, early this year, we started a regular monthly cleanup. And it might surprise you that the first cleanup we did in the hospital, we discovered something. We discovered that there were equipment that were just locked up in a room. The doctor...
And not in use.
And not, yeah, the doctor...
Okay. So, sorry I'm cutting you. We'll take it off from there after the break.
All right, thank you.
Do stay with us. We'll be right back to continue this conversation on how we as citizens can help to make our hospital work. We'll be right back. Welcome back to Talking Health with Dr. Lola, your favorite health program on television. Yes, it's 1 year anniversary of the Make Our Hospital Work campaign, being pushed by Talk Health Nigeria and so many other Nigerians who have keyed into this to help their communities. And I have two guests who has been in the studio with me talking about our healthcare system, primary healthcare specifically, and what's being done. Yes, coming back to you, Caleb Akogwu, you were talking about when you started in your community, how many are you that are driving this effort to make the Ogugu Cottage Hospital to work?
We have a WhatsApp group, and we are about 42 in the WhatsApp group. And
all Ogugu people,
Ogugu,
right?
All Ogugu people, 42
right.
of us in the WhatsApp group, and it's not majorly youth. We have stakeholders. When I mean stakeholders, we have stakeholders, clergy, general overseers, people that have done very well for the community. We're able to bring all of them together to tell them that this is actually an avenue for us to make our hospital work.
Okay. So, do you have community leaders as well?
Yes, we have community leaders as well, like the acting Ochogu, that is the paramount ruler of my community, and also the Aido Kanya is even our patron. He has given us his palace on 2 occasions to host our program, and that has even given the campaign a wider coverage and acceptability. So,
so take it off from the parts you discovered the equipment were locked and not in use.
Yes, I think we discovered one, which I can still remember. I've only seen that equipment in television. I think you're a medical doctor. You're a medical doctor, and I'm a botanist, so you should know better. It's theater light.
Okay.
And the theater light, I can say it's worth million. But the doctor said when he came, he was not given. Nobody told him about those equipment. So they were just locked in the room. So when we came for the cleanup, we discovered that there was a need for us to clean the room as well. So we discovered a lot of equipment. And as I speak to you now, the hospital and the doctor, they are making use of the equipment. And the cleanup is not just for a month. We've continued the cleanup for every month. It's unfortunate we didn't do for the one of last month, but we are going to do that one for this month.
Okay, and so you community volunteers go to clean up the hospital.
Yes, community volunteers. And it might also interest you to know that the last 3 cleanup exercises we did, we had a Reverend Father Boniface Opalua. He was there, he cleared the grass, and is even one of our advisors. And we also have many members.
So you continue with that. Let's get back because our time is quite short.
All right, thank you.
So, Dr. Mabogunje, we've talked about the roles of communities. One of the things in the health sector is there's huge presence of donor-supported interventions and NGOs doing programs. But it's been observed, and of course I've observed that in many cases, having been involved deeply in NGO work, that when you have NGO interventions, there are a lot of incentives, money and other things, and things appear to be working. And immediately the intervention ends, it appears everything goes back to status quo, no sustainability. And this is actually why the Make Our Hospital Work want to say, okay, let's citizens, be the lead. Of course, anybody can provide support, but why is there usually no sustainability in these interventions from your experience?
Dr. Laz, there used to be community engagement. When I first became a medical doctor, people were willing to do. But it's not just the hospital, it's the entire system of Nigeria that has gone the other way. Because people now have a compliance attitude that, okay, you're bringing your money, do it the way you want. But we've forgotten that other people's money is not yours. One day the person would go. He's not going to stay. Yorubas will say, you can't bring another person's child and say it's your own child. One day that child would go to his own, to where it's coming from. So it was a process that happened for quite a number of time, not just on issue of healthcare. It was a systemic process that Nigeria went through, and we became lopsided about issues that concerned us and wait for others to do it for us. You would see previously people clearing road in their community. Do you see it again? They'll be waiting for money. So it is a systemic issue that we have, and we really have to go back to the drawing board. And
so what you're saying that communities should begin to take responsibility for things that concern them.
Everything. Take responsibility for leaders, service providers, themselves. But the change must come from you.
Right. So some experts have recommended adopting a health facility, like privileged people should just pick interest. The same way communities come together to form vigilante if they have security issues, to clear the road to the farm during rainy season, you know. So influential persons should begin to say, okay, I'm adopting this health center in our community to make it work. You know, so is this something you agree to, and how can such persons go about it?
We once tried it. Unfortunately, I left that program. It's not just influential people. Like I spoke to one of them. If you come from a community and people come to you to ask you for money, if you look at the amount of money, take it down that you spend on healthcare services, it's huge. But when you make the facilities, you adopt your community, you make it work. You contribute your own quota. What I have, I'll contribute if it's finance. If I'm a labor, if I can cut wood, I would contribute it. If it's repair, I'll contribute it. Let me just tell you something shortly. When I worked in Asia Bayero Pediatrics Hospital in Kano, that was why I know communities can do a lot. It was not a PHC, but the communities were so involved in the hospital that once a month, they come and do cleaning. If a light bulb is off in Asia Bayero, the community changes. They even tell me a staff did not come to the office. It was as good as that. They installed a borehole, and when they were going to take the generator away, the community stood there and said the generator should not leave. Wow. So it is everyone within a community will give what you have. It's what you have you should give. Okay. If it's time, give your time.
Give your time.
If you are retired and you are a retired nurse, go back to your facility.
Even if it's once or twice a week to provide some services.
Give what you have. Giving back, I call it. Giving back to what you've taken from your community. Give it back.
That sounds great. I think we'll be rounding up in a couple of minutes. So I'm coming back to you, Caleb.
Yes, Doc.
Yes, you've talked about declaring, you know, community people go to make sure the cottage hospital environment is clean. You identify equipment that were not working. I'm aware that you guys made a wish list, you know, a list of the tools, equipment, the resources that the hospital needs to, you know, get better in terms of functionality. How far have you gone with that? You know, are your community members picking up items in that list to support your cottage hospital?
All right, thank you very much, Doc. You know, this a new campaign. Now, for people to believe something, they need to see your level of effort you put into it. So what we've been able to do is to ensure that the campaign sink in the mind of the people. Now, we've been able to we've written to Ogugu United Forum. Ogugu United Forum happens to be one of the best grassroots association in Nigeria. And we've also written to...
Did you do a study to know that?
Yes, they won the best...
all right, just continue.
Thank you, sir. We've also written to Ogugu Development Initiative. Ogugu Development Initiative is actually...
You have 30 seconds.
Okay, thank you, sir. It's actually made up of big boys in the town. And they've given us the assurance, they've given the community the assurance that they are coming, that we should go on. And we've also written to many philanthropists in my state, in my hometown, community. I beg your pardon, in my community, and they said we should keep the good work going, that they will definitely come and attend to the work.
Okay, so it means people are buying in.
People are buying in every day.
Okay.
Yeah.
So our time is up. Let me get your last words, ma, before we sign out.
All of us have a role to play in ensuring your facility works in your community. Even if it's your second, you go to that facility once a week to check if things are okay and you greet the workers. Please play your part. The community, the elected leaders, the school boys, the old like me, the retired, please play your part with your time. Thank you.
Thank you very much. And thank you, Dr. Lola Mabogunje, the chairperson, Strategic Advisory Board of the Make Our Hospital Work campaign. You're also a member of the National Advocates for Health.
Very well, very well, very well.
Thanks for being on the program. And Akogwu,
yes.
Caleb Onoja, team lead Ogugu Make a Hospital Work Team in Kogi State. Thanks for the great work you and your team are doing.
It's a pleasure.
And congrats on being noticed as the most outstanding community team on the campaign.
Thank you, Doc.
All right, so we hope that in the next 1 year, there will be so much more success stories.
Definitely.
Right? Definitely. So, and to you, our viewers, we thank you very much. Essentially, what the Make a Hospital Work is all about is for everyone, everybody, every citizen, either the community you are born or the community where you live, for you to get interested and play your own part. You know, government is not just those in elected office, it's all of us. And the structure of the healthcare system has made it that everybody, community, government, every institutions have one role or the other to play. So feel free to sign up to makeahospitalwork.org, you know, to have access to materials that you need to lead this campaign, you know, in your community, and let's make a hospital work. Thanks everyone, and to all the campaigners, congratulations. Let's see you same station, same time next week on this program. My name is Dr. Laz Eze. Bye for now.